Tonight, the ABC 27 investigators spotlighting the skyrocketing cost of health insurance for some of us. If you get your insurance through work, your deductibles and premiums have gone up through the years. But when it comes to insurance, there's strength in those numbers. For self-employed private contractors, it's rapidly becoming the Unaffordable Care Act.
Never had a problem with that.
John Donahue is quick with a smile and counts his blessings. He's got a wife and 4 children, a new son-in-law. He enjoys jet skiing in Ocean City and working for himself. But that is a blessing and a curse.
I mean, I choose to be self-employed, but I didn't really expect one of my battles to be for me to spend 2 to 3 times for health insurance versus someone who's an employee.
John has to purchase health insurance on the open market, has been a Highmark customer with sky-high premiums. In 2015, it was more than $15,000 a year. In 16, more than $19,000 a year. In 2017, it jumped to $33,500, and the projected cost next year, $43,800. That's $36.50 a month.
They make enough that I don't get any assistance with anything. Proud of that. But I'm reaching a point where that extra is disappearing with things that other folks aren't faced with.
This is the population that I worry about the most because they are going to see these costs. It is going to hit their bank account, their pocketbook.
PA Insurance Commissioner Jessica Altman explains that only 5% of Pennsylvanians buy on the exchanges, and 4 in 5 of those get subsidies because of their income. Statistically, only 1 to 2% are like John and make more than $96,000 a year.
Call your congressman, call your representative, ask them what they're doing also to help this population because you do matter and you are seeing these really significant cost increases and someone should be thinking about that. I am.
The insurance commissioner feels for John, so does Highmark, but there's little either can do for him. He's a cancer survivor. A tiny mole turned into a life-threatening skin cancer. He's survived physically. Financially, though, that's still up in the air.
I have no options right now. I have to have health insurance, not because the federal government mandates it, but because I care about my family, and having had cancer, I know what can happen. So I have no choice about having insurance, but I have no viable alternative to obtaining my insurance.
It's frustrating for John that people who get insurance at work or from the government pay far less and get lots more. Somebody, it seems, forgot about the self-employed.
I guess I feel like I'm being not singled out, but left with an anvil in the ocean here.
And Highmark said in a statement, our rates reflect what the true cost of care is for these ACA members. Over time, we have learned that this group is sicker compared to our commercial customers and use more health care services. Oh, by the way, John has $14,000 deductible and higher than normal co-pays. And if he worked for somebody like us and our insurance is covered, he could be just as sick, but he'd be getting a lot more coverage for a lot lower price.
It's just insane. You just wonder when they're going to figure this out. People are suffering.
Need a fix.
Yeah.